doctor with decades of experience. I've seen countless older adults come into my clinic suffering from chronic bladder infections. The frustrating part: many of them followed all the typical advice: drinking more water, maintaining hygiene, taking prescribed antibiotics, even avoiding certain foods, yet the infections kept returning. Over time, some patients started feeling hopeless, thinking this was just another part of aging. But what if I told you the real problem wasn't just in your bladder, but somewhere entirely different? Here's the shocking truth: many recurring bladder infections in seniors aren't primarily caused by poor hygiene, weakened immunity, or even aging. They're caused by something much deeper, much sneakier, and often completely ignored: your gut. Yes, your gut. That complex system of intestines, trillions of bacteria, and enzymes inside your abdomen plays a direct role in the health of your bladder. If your gut health is compromised, you're unknowingly creating the perfect environment for harmful bacteria to travel, grow, and attack your urinary tract, especially if you're over the age of 60. This isn't just a theory, it's backed by emerging science, real patient case studies, and clinical research. So today, I'm taking you deep inside your body, not to scare you, but to show you how gut issues silently fuel urinary tract problems in older adults. If you or someone you care for has suffered from bladder infections, especially recurring ones, stay with me. Because once you understand the gut-bladder connection, you'll finally be able to take control, protect yourself naturally, and break the painful cycle of infection. Let's begin with what most people overlook. The gut microbiome is an ecosystem of bacteria living primarily in your intestines. In a healthy adult, these microbes perform a wide range of vital functions: digesting food, producing vitamins like B12 and K2, protecting against pathogens, regulating inflammation, and training your immune system to distinguish between friends and foes. But here's the problem: this ecosystem becomes increasingly fragile as we age. In older adults, a combination of factors such as medications, reduced stomach acid, slower digestion, and poor dietary choices begin to tip the scale. Beneficial bacteria like lactobacillus and bifidobacterium start to disappear, while harmful bacteria and yeasts multiply. This leads to a condition known as gut dysbiosis. Dysbiosis doesn't just cause bloating or indigestion. It weakens the gut lining, allowing toxins and bacteria to slip through the intestinal walls into your bloodstream, a condition called leaky gut syndrome. And here's where things get dangerous. The bacteria that escape your gut don't just float around harmlessly. They migrate. One of their most common destinations: the urinary tract. Many bladder infections are caused by E. coli, a bacterium that originates in the gastrointestinal tract. In a healthy body, E. coli is mostly harmless when it stays in the gut. But with dysbiosis, leaky gut, and a weakened immune barrier, these bacteria can translocate, or move, from your intestines to your bladder. In women, especially postmenopausal women, the urethra is shorter and closer to the anus, which increases the chances of bacteria reaching the bladder. In men, enlarged prostates and poor bladder emptying due to age make it easier for bacteria to multiply once they arrive. But it gets worse. When the gut is inflamed, and most older adults with gut issues experience some form of inflammation, this triggers a systemic immune response. The body goes into a state of chronic low-grade inflammation, which weakens the immune system's ability to respond effectively to bladder infections. So not only are the bad bacteria arriving at your bladder, your immune system isn't equipped to fight them off. Let me give you a practical example. Imagine an elderly woman named Evelyn, age 72. She starts taking proton pump inhibitors. PP is for acid reflux, a common medication among seniors. What she doesn't know is that PP is drastically reduced stomach acid, which is essential for killing harmful bacteria and maintaining gut flora balance. Within months, Evelyn begins experiencing bloating, constipation, and fatigue. A year later, she suffers her first bladder infection. It clears up with antibiotics, but returns just 2 months later. This cycle continues for over a year. What's going wrong? Each round of antibiotics wipes out more beneficial gut bacteria. The PPs continue weakening her gut lining. The E. coli in her gut become dominant, leak into her bloodstream, and settle in her bladder. Her doctors keep treating the bladder, but no one looks at her gut. This is more common than most people realize. And it's not just PPs. Seniors often take multiple medications, NSAIDs for arthritis, anticholinergics for overactive bladder, antibiotics for past infections, and even antidepressants. All of these can disrupt the gut microbiome and reduce motility, slowing down digestion and allowing harmful bacteria to multiply. Then there's the diet. Older adults often consume less fiber, less fermented food, and more processed meals due to chewing problems or convenience. This starves good bacteria and feeds the bad ones. The gut lining becomes thin and inflamed. Toxins and microbes leak out. Your immune system is overwhelmed. So now we're dealing with a perfect storm: the gut full of bad bacteria, leaky intestinal wall, a sluggish immune system, and bacteria that have learned how to reach the bladder and take hold. Bladder infections in seniors, especially when they recur, are almost always a signal of deeper gut imbalance. And until you heal the gut, the infections won't truly stop. Let's also touch on antibiotics, since they're the first line of defense for most bladder infections. Unfortunately, they're both a solution and a silent threat. They kill the immediate infection, yes, but they also devastate the microbiome. With every course of antibiotics, the diversity of gut bacteria drops further. This leaves the gut wide open to future infections. Worse still, E. coli and other bacteria can develop resistance, making antibiotics less effective over time. In fact, studies show that over 30% of women over age 65 will have at least one antibiotic-resistant bladder infection in their lifetime. That's not just a frustrating statistic, it's a public health crisis waiting to explode. The good news: the gut can heal, but it requires specific changes, knowledge, and consistency. And that's exactly what we'll explore next. Let's go even deeper in the next segment into how to rebuild the gut, the specific foods to avoid, the foods that help, the supplements that truly work, and how to protect your bladder through gut support, not just antibiotics. Now that we understand the deep connection between gut health and bladder infections in older adults, let's talk about how to break this cycle. It starts with rebuilding the gut microbiome, healing the intestinal lining, and supporting your body's natural defenses, not just treating symptoms, but correcting the root cause. So, how exactly do you start? First, you need to restore bacterial balance in the gut. That means reintroducing beneficial bacteria while starving the bad ones. It may sound simple, but for seniors, there are unique considerations because the digestive system slows down with age, stomach acid production drops, and nutrient absorption weakens. The first thing to focus on is diet. Most older adults eat diets high in refined carbs, sugars, and processed foods. These feed harmful bacteria like E. coli and Clostridium difficile. On the flip side, beneficial bacteria feed on prebiotic fibers, the kind found in vegetables, legumes, seeds, and whole grains. So here's what to start doing immediately. 1. Add high-fiber foods daily. Think leafy greens, asparagus, leeks, onions, garlic, flax seeds, chia seeds, and oats. These prebiotic-rich foods help feed the healthy bacteria already in your gut and help new ones take hold. 2. Include fermented foods. Yogurt with live cultures, kefir, sauerkraut, kimchi, and miso contain living probiotics that help repopulate the gut. Even a spoonful or two per day can make a difference. Just be sure it's unpasteurized and contains live cultures. 3. Cut down sugar and processed foods. Sugar feeds yeast and bad bacteria like Candida, which can exacerbate gut inflammation and increase infection risk. Avoid soda, white bread, pastries, and most packaged snacks. 4. Drink plenty of filtered water. Dehydration thickens urine, slows digestion, and makes it easier for bacteria to settle in the bladder. Aim for small, steady sips throughout the day. 5. Avoid artificial sweeteners. Substances like sucralose and aspartame harm gut flora. Many sugar-free gums, diet sodas, and protein shakes marketed to seniors contain these ingredients, and they silently destroy bacterial diversity. Next is supplementation. While food is the foundation, supplements can help speed up healing, especially if the gut has been damaged over many years. 1. Probiotics. Choose a high-quality, multi-strain probiotic with at least 20 to 50 billion CFS per capsule. Look for strains like Lactobacillus rhamnosus, Lactobacillus reuteri, Bifidobacterium longum, and Saccharomyces boulardii. These strains not only support gut health but also lower E. coli levels in the bladder, 2. Prebiotic fiber powders. If it's hard to get enough fiber from food, consider powders like inulin, acacia fiber, or partially hydrolyzed guar gum. Start slow to avoid bloating. 3. Digestive enzymes. These support proper food breakdown, especially in seniors with low stomach acid. Enzymes like protease, lipase, and amylase help reduce fermentation in the gut and lower bacterial overgrowth. 4. L-glutamine. This amino acid repairs the gut lining and reduces permeability. It's especially useful for leaky gut syndrome and can help restore the intestinal barrier. 5. Zinc carnosine and aloe vera extract. Both have been shown to soothe and heal the gut lining while reducing inflammation. Let's move on to lifestyle changes that support gut and bladder health. 1. Avoid unnecessary antibiotics. Always question if antibiotics are truly necessary, and if prescribed, pair them with probiotics taken at least 2 hours apart to reduce gut damage. 2. Stay active. Gentle walking, yoga, and stretching improve circulation, digestion, and lymphatic drainage, all of which help detoxify the body and reduce infection risk. 3. Sleep deeply and consistently. The gut has its own circadian rhythm. Poor sleep disrupts the balance of gut bacteria and lowers immune function. Try to sleep and wake at the same time each day, avoid screens before bed, and limit caffeine after noon. 4. Manage stress. Chronic stress affects gut motility, increases inflammation, and alters the gut-brain axis. For seniors, even low-level anxiety or loneliness can trigger major changes in digestion and immune regulation. Practices like deep breathing, meditation, journaling, or even gentle gardening can have powerful gut healing effects. Now let's talk about what to watch out for signs your gut is still contributing to your bladder problems: frequent bloating, gas, or heartburn, constipation or diarrhea that lasts more than a week, food intolerances that seem to increase over time, brain fog, anxiety, or fatigue with story of antibiotic use or acid-blocking medication, recurring bladder infections. Despite drinking more water and maintaining hygiene, these are red flags that your gut. Some patients have asked me, "Doctor, even if I fix my gut, how do I know it's helping my bladder?" Here's what you should start noticing: fewer or no infections over several months, less urgency and burning when you're urinating, improved digestion and appetite, better energy and mood, reduced need for medications like PPs or laxatives. Let me tell you about another patient, Harold. He was 76 and came in frustrated after his 4th UTI in a year. He was already taking cranberry pills, drinking water, and staying clean. We did a gut health test and found he had almost no beneficial bacteria left, completely wiped out from years of antacids and antibiotics. We changed his diet, added a probiotic and digestive enzyme, removed sugar, and supported his gut lining with glutamine. Within 2 months, not only did his UTI stop returning, but his acid reflux went away too. He told me he hadn't felt this light in years. The reality is this: when you heal your gut, everything starts to change, not just your bladder. But this journey requires patience. It may take 8 to 12 weeks before you see full results. That's why most people give up. But if you stay consistent and target the root cause, you'll be ahead of 90% of others who keep masking symptoms instead of solving the problem. Now that you've committed to the path of healing your gut to protect your bladder, let's move into the most actionable part of this journey: what you should eat, what you must avoid, and how to build a daily routine that keeps your gut strong and your bladder infection-free for the long haul. Let's begin with gut healing foods that should be part of your daily life. These are not exotic ingredients, they're everyday, affordable items that are easy to prepare and digest, especially for older adults. 1. Bone broth, rich in collagen, glutamine, and minerals. Bone broth helps repair the gut lining and reduces inflammation. You can sip it like tea or use it as a base for soups. Chicken and beef bone broth are both excellent, but ensure it's slow cooked or pressure cooked for maximum nutrient extraction. 2. Steamed vegetables. Raw veggies can be hard to digest for many seniors, so go for gently steamed ones like carrots, spinach, zucchini, and green beans. They're rich in fiber but easy on the gut. 3. Cooked apples and pears. These fruits, when stewed or gently cooked with a little cinnamon, become soft, easy to digest, and high in pectin, a type of fiber that nourishes beneficial gut bacteria. 4. Plain yogurt with live culture issues, full fat, and sweetened yogurt with live probiotics. Avoid flavored yogurts that are loaded with sugar. Greek yogurt or homemade curd is often the best choice. 5. Flaxseed or chia pudding. Soak chia or flax seeds overnight to create a gel-like consistency. These are excellent sources of omega-3 salt and fiber and help regulate bowel movements gently. 6. Fermented vegetables. Start small with sauerkraut or kimchi, just a tablespoon a day. These are natural probiotics that can help replenish good bacteria in your gut. 7. Wild-caught salmon and sardines rich in omega-3 fatty acids. These help reduce gut inflammation and support immune function, which is key in preventing infections from spreading. 8. Herbal tea. Chamomile, ginger, licorice root, and slippery elm tea are all calming to the gut and reduce inflammation. Avoid caffeinated teas, which may irritate the bladder. Now let's look at foods and substances you must avoid if you're serious about healing your gut and stopping bladder infections. 1. Refined sugar and artificial sweeteners. Sugar feeds bad bacteria like E. coli and Candida. Artificial sweeteners like sucralose and aspartame have been proven to disrupt gut flora. Check every label, especially on drinks, protein bars, and sugar-free gum. 2. Alcohol, even a small amount, can damage your gut lining, disrupt sleep, and weaken your immune system. If you must drink, limit it to an occasional glass of dry wine and avoid beer, which often contains yeast that worsens gut problems. 3. Fried and processed food. Chips, pastries, fried snacks, deli meats, and frozen dinners are often full of preservatives, seed oils, and additives that irritate the gut lining. 4. Gluten and dairy. In some cases, not everyone is sensitive, but many older adults develop delayed intolerance to gluten and conventional dairy. If you're bloated, fatigued, or have joint pain after eating bread or milk, try eliminating them for 3 to 4 weeks to see if symptoms improve. 5. Acid-blocking medications. This include PPIs like omeprazole or lansoprazole. They may offer relief in the short term but destroy gut acid balance, which is essential to keeping harmful bacteria in check. Always work with a doctor before stopping any medication.